Welcome to this in-service education video on the heelmedix Heel Protector presented by Medline. In this video, you will learn the indications for when to use the heelmedix Heel Protector device, how to properly apply the heelmedix device on your patient, how to use DVT compression devices simultaneously with the heelmedix, and how to use the optional stabilizer wedge duo to reduce lateral and medial foot rotation. Because pressure ulcers typically develop over bony prominences, offloading pressure from those sites is an effective preventive measure. For heels, pressure relief is usually granted by devices that raise the heel and provide it with gentle cushioning. When your facility's protocols for skin health and risk assessment indicate that a particular patient is at risk for skin breakdown or pressure ulcer development, the heelmedix Heel Protector may be one of the several interventions you may decide to perform. The heelmedix is designed to protect against pressure, friction, and shear by offloading the heel. Remove the heelmedix from its plastic outer packaging. The boot comes packed in a mesh laundry bag. Save that, because the heelmedix is machine washable. A multilingual instruction set is included in the package, which you may refer to anytime. The heelmedix comes ready to use. Start by unfastening the straps. Make a mental note of how they look because they will go back the same way when the boot is placed on your patient. Place the heelmedix on the bed with the long side of the boot beside your patient's leg and the boot opening facing up. Carefully place your patient's foot into the boot with the lower leg on the long side of the boot and the heel above the opening. This positioning will help ensure that the heel is offloaded. Check to see that the heelmedix tag is on the outside of the boot and near the bottom of the patient's foot. If it is, you've applied the boot correctly. You can also label the patient's name or room number to help simplify washing and sorting. The 4 heelmedix straps use a hook and loop fastening system with a large landing panel on the side of the boot to accommodate most any size foot and leg comfortably. They don't have to be pulled tight to be effective. Start with the 2 straps farthest from the foot. Beginning with the farthest strap, cross them straight over the leg and secure to the other side. The straps should be roughly parallel. They can be snug, but not tight. There are 2 ways to use the lower straps, that is the 2 straps closest to the toes. Option 1 for the lower straps is to crisscross them, making an X. This strapping option offers good protection, keeping the foot and lower leg secure. Option 2 for the lower straps is to position each of the lower straps on its own side of the leg at a slight downward angle from the toes to the side of the leg. Using this option, the lower straps do not cross each other. Make sure the strap doesn't touch the patient. This strapping option provides more room for larger feet or compromised toes, allows more air circulation for a cooler foot, and provides enhanced protection against foot drop. After you have secured the lower 2 straps, either option 1 crisscrossed or option 2 same side, check to see that the heel is offloaded properly. To check, feel around the heel opening at the bottom of the boot and confirm that the heel is properly elevated. If it isn't, reposition the heel and readjust the straps. The heelmedix works with most DVT compression devices. When the patient will be using both a DVT compression device and the heelmedix, position the tubing in between the straps. Make sure the tubing is not causing pressure or friction on the patient's skin. To prevent lateral and medial foot rotation, an optional stabilizer wedge duo is available to use with the heelmedix. They come as a pair and are packaged separately from the heelmedix. Each of the stabilizer wedges attaches to the heelmedix with the same hook and loop fastener that the straps use. You can use one or both on your patient depending on what care they need. To apply the stabilizer wedge duo, start with the patient's foot upright, toes toward the ceiling. The stabilizer wedges are not machine washable. Wipe them clean with a cloth or disposable wipe. They are treated with an antifungal product and are bacteria resistant. Finally, it is especially important to explain to the patient that he or she must not walk with the heelmedix on. If a patient needs to get out of bed while wearing a heelmedix, explain that the nurse or caregiver should be called. For more information, please call us at 1-800-MEDLINE or visit medline.com.